penile implant is recommended for your treatment because more conservative methods have failed and have not provided the satisfactory result that you desire. A penile implant procedure, in my practice, generally occurs at an ambulatory surgery center, though in some circumstances does have to be done at the hospital. Generally, you'll arrive at the surgery center, you'll be checked in, have an IV placed, and the nurses will go over pre-op questionnaires and give you intravenous antibiotics that reduce the risk of infection. I will speak to you prior to the surgery, and the anesthesia team will also speak to you prior to the surgery. Once that is all taken care of, you're brought into an operative suite where you get anesthesia and the surgery is completed. Once the surgery is completed, you go to a recovery room where you wake up, are given medication to keep you comfortable, and we go over all the post-operative instructions once you're adequately awake. In general, most of my patients do have a small drain placed at the time of surgery, which stays in until post-operative day 1, where patients follow up with our nurse practitioner in the office, where they will check the incisions, remove the dressing, and remove the drain. I generally see my patients roughly 3 weeks after surgery to make sure everything is going well and the healing is occurring as expected. In most circumstances, the patient will need to be evaluated by either their medical doctor or their cardiologist to make sure they're optimized for this surgery. Prior to the surgery, we tend to start oral antibiotics one day before, generally the morning before, the evening before, and the morning of, with a small sip of water. And we have patients use an antiseptic scrub the day before the surgery and possibly the morning of the surgery. And this will be provided at the time of surgery scheduling. In general, most medications can be continued as long as it's okayed by your medical doctor, though we do recommend discontinuing blood thinners prior to surgery or anything that can increase the risk of bleeding. Prior to any surgery with a general anesthetic, we generally want the patients not to eat or drink anything other than meds with a small sip of water for at least 6 to 8 hours prior to surgery. It is not necessary to shave before the surgery. In fact, we would prefer that you do not because it can cause cuts, which can increase the risk of infection. Before the surgery, you could always reach out to my office and speak to my surgery scheduler, one of the nurses, or if you can't get your question answered by them, I'm happy to speak to you too.